This video demonstrates how to replace a balloon-retained gastrostomy tube, either a G-tube or a button. This procedure is carried out every 3 to 6 months, dependent on tube type, or if the tube falls out. Firstly, explain the procedure and gain consent. Wash your hands and put on an apron and gloves. Ensure the patient is comfortable and preferably lying flat on their back. Place a towel or a waterproof sheet to protect the patient and their clothing. Next, prepare the new balloon tube. Firstly, check you have the correct size replacement and that it's in date. Open the packet. Close the end caps and move the external fixation disc. Finally, check the balloon inflation by filling a Lewis lip syringe with the correct volume of water. This is written on the inflation port. Attaching the Lewis lip syringe to the inflation port, fill the balloon and ensure it is intact. When you are happy with the inflation, deflate the balloon and place the pre-filled syringe to one side. Place the balloon end of the tube into the lubricating jelly and set to one side. If there is a tube currently in the stoma tract, it is a good idea to check the pH by taking a gastric aspirate. Attach a 60 ml enteral syringe to the feeding port and draw back on the plunger to get some gastric juice. Drip over a pH strip. Now compare to the chart on the pH pot. A pH of 5.5 or less indicates it is in the stomach. This pH can be used for comparison when the new tube is inserted. Next, you will need to deflate the balloon of the current tube. Using an empty 5 ml Lewis lip syringe, ensure all the water has been removed. You may want to empty the syringe and reattach. Once the balloon is deflated, gently remove the tube, having some gauze to hand to prevent splashes. Alternatively, if there is an end plug in the stoma tract, remove this gently. Now, taking the new balloon tube, gently insert it into the stoma tract. If it is a G-tube, advance it until it reaches the 5 to 6 centimetre mark. If it is a button, advance until the head of the button is flush with the tummy. Now, taking the pre-filled Lewis lip syringe, inflate the balloon with the required volume of water. Now is the time to recheck the gastric aspirate. Again, attach a 60 ml enteral syringe to the feeding port and pull back to obtain aspirate. Drip this over a pH strip and compare with the chart on the pH pot. A pH of 5.5 or less indicates it is in the stomach. Finally, gently pull on the tube until resistance is felt. If using a G-tube, move the fixation disc to within a few millimetres of the tummy. Using a 60 ml enteral syringe, you may now flush the tube with water. Before leaving the patient, ensure they are comfortable when both lying and sitting. When you have finished, dispose of the waste and wash your hands.